Welcome to our YouTube video, where we shed light on the important topic of mesothelioma. Join us as we delve into the causes, symptoms, and treatments of this rare cancer, aiming to spread awareness and provide valuable information to those affected by this disease. Stay tuned for insightful discussions, expert interviews, and inspiring stories that highlight the resilience and strength of individuals battling mesothelioma. Together, let's raise awareness and support those impacted by this challenging condition. Subscribe and hit the notification bell to stay updated on our mesothelioma journey. Let's make a difference. What is mesothelioma? Mesothelioma is a type of cancer that affects the mesothelium, which is a thin layer of tissue that covers many of the internal organs of the body. It most commonly affects the lungs, but can also occur in the abdomen, heart, and other areas. What are the primary causes? The primary cause of mesothelioma is exposure to asbestos, a naturally occurring mineral that was widely used in a variety of industries from the 1940s through the 1970s. Asbestos was used in many building materials, including insulation, roofing shingles, and ceiling tiles, and was also used in many other products, such as automotive parts, textiles, and even talcum powder. When asbestos fibers are inhaled or ingested, they can become lodged in the lungs or other tissues, causing damage to the cells and eventually leading to the development of mesothelioma or other asbestos-related diseases. The risk of developing mesothelioma is directly related to the amount and duration of asbestos exposure, with people who were exposed to high levels of asbestos over a long period of time being at the greatest risk. It's important to note that not everyone who is exposed to asbestos will develop mesothelioma, and other factors, such as genetics and smoking history, may also play a role in an individual's risk of developing the disease. However, exposure to asbestos is by far the primary cause of mesothelioma, and taking precautions to avoid exposure is the most effective way to prevent the disease. What are the symptoms? Mesothelioma symptoms can vary depending on the location and stage of the cancer. However, some common symptoms of mesothelioma include 1. Shortness of breath. This is often one of the first symptoms of mesothelioma and can be caused by fluid buildup in the pleural space around the lungs. 2. Chest pain. Pain in the chest or rib area can be caused by the tumor pressing on nerves or other structures in the chest. 3. Persistent cough. A chronic cough that doesn't go away can be a sign of mesothelioma, especially if it's accompanied by other symptoms like chest pain or shortness of breath. 4. Fatigue. Feeling tired or weak can be a symptom of mesothelioma, as the body works to fight the cancer and cope with other symptoms. 5. Weight loss. Losing weight without trying can be a sign of many different health issues, including mesothelioma. 6. Abdominal pain and swelling. Mesothelioma that occurs in the abdomen can cause pain, swelling, and digestive problems. 7. Anemia. Low red blood cell counts can cause fatigue, weakness, and shortness of breath. It's important to note that these symptoms can also be caused by other health conditions, and having these symptoms does not necessarily mean that a person has mesothelioma. If you're experiencing any of these symptoms, it's important to see a healthcare provider for a proper diagnosis and appropriate treatment. How to treatment for mesothelioma? The treatment options for mesothelioma depend on several factors, including the stage of the cancer, the location of the tumor, the individual's overall health, and their preferences. Some common treatment options for mesothelioma include 1. Surgery. Surgery may be recommended to remove as much of the cancer as possible, particularly in early stages of mesothelioma. Types of surgery may include pleurectomy/decortication, P/D, or extrapleural pneumonectomy, EPP, for pleural mesothelioma, and cytoreduction surgery with heated intraperitoneal chemotherapy, HIPEC, for peritoneal mesothelioma. 2. Radiation therapy. Radiation therapy uses high-energy rays to kill cancer cells and shrink tumors. It may be used before or after surgery or as a standalone treatment for mesothelioma. 3. Chemotherapy. Chemotherapy uses drugs to kill cancer cells and is often used to treat advanced mesothelioma. It may be given orally or intravenously. 4. Immunotherapy. Immunotherapy is a newer treatment option for mesothelioma that uses drugs to boost the body's immune system to fight cancer cells. 5. Palliative care. Palliative care is focused on managing symptoms and improving the quality of life for individuals with mesothelioma. It may include pain management, nutritional support, and other interventions to improve comfort and well-being. It's important to note that each person's treatment plan may be unique, and the most appropriate treatment approach will depend on a variety of individual factors. It's important for individuals with mesothelioma to work closely with their healthcare providers to develop a comprehensive treatment plan that addresses their unique needs and preferences. How long are the final stages of mesothelioma? The final stages of mesothelioma can vary in duration depending on several factors, including the individual's overall health, the extent and location of the cancer, and the effectiveness of treatment. However, in general, the final stages of mesothelioma can last from a few weeks to a few months. During the final stages of mesothelioma, the cancer may have spread to other parts of the body and the individual may experience severe symptoms such as pain, difficulty breathing, fatigue, loss of appetite, and weight loss. These symptoms may become increasingly difficult to manage with conventional treatments, and the focus of care may shift to palliative care to improve the quality of life and manage symptoms. It's important to note that everyone's experience with mesothelioma is different, and there is no way to predict exactly how long the final stages will last. However, it's essential for individuals with mesothelioma to work closely with their healthcare providers to develop a comprehensive treatment plan and to receive support for managing their symptoms and improving their overall quality of life.